Well, for more on the U.S. opioid crisis and legalized marijuana, I'm joined by Dr. David Gastfriend, live from Boston, Massachusetts. He's Chief Medical Officer at Dynamicare Health. Welcome, David.
Thank you. Nice to be here.
So let's start by talking about the timing and the importance of China's decision to treat all variants of fentanyl as controlled substances.
It's a very important decision. We've been waiting for it since 2018. There are many forms of fentanyl. Fentanyl is easily converted into new forms. And so when we only had restrictions on existing forms, it really wasn't sufficient because it was so easy to add new forms and evade all controls. So this decision is a really important one for starting to stem the flow of fentanyl and its other similar compounds into the U.S.
And you do say that this is a start. So what sort of impact could we see in both the legal and potentially the illegal fentanyl markets?
Well, it's really about the illegal fentanyl market. The legal fentanyl market is for medical treatment. It's heavily regulated and monitored. The illegal marketing is an enormous situation. There are literally tens of thousands of laboratories across China that are making fentanyl and other forms of fentanyl, newer forms that previously were not considered controlled substances. So this new law will change that and make all of them, even new ones that haven't yet been developed, they will be controlled substances as well. And that will make it easier to start monitoring, testing, raiding these labs, blocking the shipments, and interrupting the flow. But it's really just a start.
Now, obviously, there are other countries involved, and there are a lot of different places to try and stem this flow of fentanyl getting into the U.S. But give us an idea of the contributing factors that caused the opioid crisis to get to this point in the U.S.
The U.S. opioid crisis started with excessive prescribing of opioid pain medications by doctors. And they were pressed into this through the efforts of major opioid medication manufacturers. They were developing more potent forms of opioids that were supposed to be marketed only for severe or malignant pain, as in end-stage cancer, and instead they worked on doctors to get them to prescribe for all kinds of pain. They even pressed medical societies and accreditation bodies for hospitals to ask every patient in a hospital, do you have any pain at all? And if the pain wasn't zero, if the pain was anything above zero, the idea became common that some kind of prescribing should occur. And that just led to a gradual, excessive prescribing practice. That's now getting stopped because of medical education. But the problem is all those people who got started on these opioid medications are now turning to street drugs. And the street drugs have turned from heroin, which is twice as potent as morphine, maybe 5 times as potent, to fentanyl, which is maybe 50 to 100 times more potent.
So then, David, what should Big Pharma's responsibility be now in terms of preventing and treating abuse?
Well, Big Pharma needs to be regulated more carefully. Medication distribution networks, those commercial systems that distribute the medications, need to be overseen. The U.S. Drug Enforcement Agency needs to use all of the regulations at its disposal. And we need to have a very extensive network of treatment and prevention approaches. There are lots of different components, and it's really affecting every stratum of society in the U.S. and every community.
Now let's look at this issue of marijuana. We have anti-legalization proponents saying that marijuana is a gateway drug for more dangerous substances. And then in states where medical marijuana is legal, some doctors suggest that marijuana can be used as an exit drug, as in a viable treatment option for opioid abuse. What are your thoughts?
Well, the data are pretty clear about the epidemiology. About 10% roughly of people who use marijuana will become dependent on it. That is, they'll have a disorder, an illness of addiction. Now, there's a lot of people who use marijuana, and if 40 to 50% of Americans use marijuana at some point in their life, that means the proportion who eventually will become sick, addicted with marijuana, is going to be a very meaningful proportion of people. The treatment of marijuana is a problem because we actually don't have any medications that treat it, and many have been tried. So right now we only have psychological treatments. They're not largely effective. They're the only things we have. Approaches that could be more effective, such as directly accessing the reward system with incentives, something called contingency management, is not widely used in this country. And so we're going to have a problem with the rapidly increasing rate of marijuana use in the United States.
All right, thank you so much. Dr. David Gastfriend there, Chief Medical Officer at Dynamicare Health.